Hello, Namaskar. I am Dr. Murali Manohar. Welcome to my lecture Ayurveda Samhita. In this program, we will be learning and knowing about an important topic and some powerful ancient Indian Ayurvedic secrets. These can change and improve your entire life.
Acute prostatitis. Acute prostatitis is caused by a bacterial infection of the prostate gland. Symptoms include pain, mainly at the base of the penis and around the anus. A bladder infection commonly occurs at the same time. Treatment includes person-specific traditional Ayurvedic drugs, prescribed based on your constitution, and pulse examination. Definition: prostatitis means that you have inflammation of your prostate. Prostatitis can be acute, sudden onset, or chronic, persistent. It can also be infective, caused by infection, or non-infective. Acute prostatitis is a type of infective prostatitis. It is caused by a bacterial infection of the prostate. Chronic prostatitis is sometimes called chronic pelvic pain syndrome. Prostate gland. Only men have a prostate gland. It lies just beneath the bladder. It is normally about the size of a walnut, 20 grams. The urethra, the tube that urine travels along from the bladder to the outside, runs through the middle of the prostate and then through the penis. The prostate helps to make semen, but most semen is made by another gland nearby, the seminal vesicle. Causes: 1. Infection by bacteria that normally live in your bowel. This is the usual cause. Some bacteria that live harmlessly in the bowel commonly get onto the skin near to the anus when we pass feces. In some people they may then multiply. Some of these bacteria may then travel up the urethra and cause infection anywhere in the urinary tract, that is, the kidneys, bladder, prostate, or urethra. 2. Urine infection with cystitis. Bladder infection is the common urinary tract infection. But a prostate infection may also occur with or without other parts of the urinary tract being infected. Some conditions that cause pooling or blockage of urine increase the risk of a urinary tract infection. For example, having an enlarged. This is because bacteria often thrive and multiply quickly in pooled urine. Less common causes. 1. Damage to the prostate makes it more prone to infection, for example, after prostate surgery. 2. A catheter passed into the bladder through the urethra may sometimes let bacteria travel to the prostate. This can also happen after a telescopic instrument is passed through the urethra into the bladder, as happens during investigation of the prostate gland and the bladder. 3. Sometimes the prostate is infected by bacteria in the bloodstream that have traveled from other infections in the body. Note: acute prostatitis is not considered a sexually transmitted infection, so a sexual partner is not at risk. Prevalence and incidence. Acute bacterial prostatitis is not that common. Only about 2 in 10,000 men will develop acute prostatitis at some point in their lives. Symptoms. In acute prostatitis, symptoms develop quickly, typically over a few days or so. It usually occurs at the same time as a urine infection. Therefore, you may also have a bladder infection, cystitis. Bacteria, germs, are found in your urine if a urine sample is taken. Symptoms include: 1. Pain from your prostate, which may be severe. You feel this mainly at the base of your penis, around your anus, just above your pubic bone and/or in your lower back. Pain may spread to your penis and testes. Passing stools, feces, can be painful. 2. Symptoms of a urine infection. For example, pain when you pass urine, passing urine frequently, an urgent desire to pass urine, and sometimes blood in your urine. Some people can develop problems so that they are unable to pass urine and the urine builds up in the bladder. This is called urinary retention. 3. Fever, high temperature. General aches and pains. You generally feel ill. 4. A slight discharge, thick fluid, may come out of your penis from your urethra. 5. Your prostate feels tender if you are examined with a gloved finger in your rectum. Investigations and tests. A urine test will usually detect bacteria if you have acute prostatitis. Other tests such as X-rays or scans may be advised following acute prostatitis. This is to rule out any problem with your urinary tract that may have contributed to causing the infection. Acute prostatitis can produce similar symptoms to a sexually transmitted infection. For this reason, if you are at risk of a sexually transmitted infection, you may be suggested to undergo some swab test or urine test to exclude this. But note, acute prostatitis is not a sexually transmitted infection. Ayurvedic treatment. Home remedies. 1. Lemon is popularly used. Lemon juice should be given 2-3 times a day mixed with sugar and water. 2. Carrots are also helpful in controlling burning urine. 3. Radish juice 25 ml given twice daily. 4. Fresh coconut water given once a day. 5. Cigar cane also can be consumed as much as one can. 6. Jamun is also very good, 100 grams, should be taken daily. Simple Ayurvedic remedies. 1. Gakshururati Gugulu is the drug of choice. 1 tablet 3 times a day. 2. Chandraprabhavati is another which is very effective, 1 tablet twice daily. Do's and don'ts. 1. Hot spices should be avoided. 2. Exposure to sun and heat is to be avoided. 3. Lots of liquids should be consumed. Prognosis, an outlook. Acute prostatitis usually clears with a course of Ayurvedic drugs. However, it is important to take the full course to clear the infection complete. There is a risk that an acute infection may become a chronic, persistent infection if you do not take the full course of medicines. Rarely, apart from chronic bacterial prostatitis, other complications of acute prostatitis can occur. These include 1. Acute, sudden, urinary retention. Because it may be so painful to pass urine, urine can build up in your bladder, causing pain in your lower abdomen and inability to pass urine at all. 2. Prostate abscess. If you have neglected prostate infection, rarely you can develop an abscess of your prostate gland. Further tests are needed to confirm a prostate abscess, such as an ultrasound or CT scan of your prostate gland. Ayurvedic treatment plan. Please keep in mind that these are all common home remedies and first aid measures. If the problem continues, even after using these remedies, then you need to come for personal examination, an Ayurvedic body type evaluation. In Ayurveda, there are excellent and powerful medicines for this condition. The best suitable drugs are selected basing on your individual body type, and prescribed along with personalized diet and lifestyle modifications.
So, hope you have enjoyed this topic and enlightened. In the next program, we will be meeting with another interesting and important topic. Satam Jiva, Sarado Vardhamanaha. Satam Hemantan, Satam Vasantan. Live your entire life with excellent health and total happiness. Take care of yourself. Subham.
Dr. Chirumamilla Murali Manohar MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.